Welcome to our channel. Today, we will be delving into the intricate topic of hypothyroidism, a significant health condition that affects the thyroid gland. Hypothyroidism is a complex medical condition characterized by an underactive thyroid gland, leading to insufficient hormone production that is essential for regulating the body's metabolism. Hypothyroidism occurs when the thyroid gland fails to produce an adequate amount of hormones, leading to symptoms such as fatigue, weight gain, and depression. Join us as we explore the complexities of hypothyroidism and learn how to effectively manage this condition for a healthier future. Hypothyroidism can be caused by various factors, with primary causes typically stemming from issues within the thyroid gland itself. One common primary cause is autoimmune diseases like Hashimoto's thyroiditis, where the immune system mistakenly attacks the thyroid. Atropic thyroiditis is another autoimmune disease that can lead to hypothyroidism. Additionally, iodine deficiency, which is essential for thyroid hormone production, can result in hypothyroidism, especially in regions with low iodine intake. Iatrogenic causes such as thyroid surgery or radiation therapy for neck cancers can also damage the thyroid gland. Certain medications like amiodarone, lithium, and anti-thyroid drugs can also affect thyroid function. Congenital conditions, such as absent or ectopic thyroid glands, dyshormogenesis, and TSH-R mutations, can lead to hypothyroidism. Infiltrative diseases like amyloidosis and sarcoma can also impact thyroid function. Hypothyroidism can develop due to dysfunction in the thyroid gland or abnormalities in other glands, leading to secondary hypothyroidism. This condition is often linked to hypopituitarism, hypothalamic disorders like tumors or irradiation, or isolated TSH deficiency. Temporary hypothyroidism may occur from silent thyroiditis, especially postpartum, or subacute thyroiditis. These diverse causes can present with a wide range of symptoms and complications in individuals with hypothyroidism, making it crucial to identify and address treatment accordingly. Hypothyroidism is a complex medical condition that can manifest in a wide range of symptoms. Some common complaints include persistent fatigue, unexplained weight gain, and heightened sensitivity to cold temperatures. Additionally, individuals with hypothyroidism may experience constipation, dry skin and hair, difficulty concentrating, and hoarseness of voice. In more severe cases, patients may also report hand numbness, heavy menstrual bleeding, and issues with fertility. Due to the diverse array of symptoms associated with hypothyroidism, diagnosis can be challenging. When a patient presents with symptoms suggestive of hypothyroidism, the doctor also asks whether they had any surgeries to remove the thyroid gland, underwent radiation therapy, any treatments or medications used, and the presence of a family history of thyroid diseases like autoimmune thyroiditis. Then, examine the neck for goiter and other physical signs. When diagnosing hypothyroidism, doctors will closely examine symptoms such as bradycardia, abnormally slow heart rate, myxedema, swelling of skin and tissues, and delayed reflexes. Additional indicators of the condition may include a visibly enlarged thyroid gland, dry and rough skin, a swollen face, general hair loss, fluid buildup around the lungs and heart, lactation without pregnancy, and high blood pressure. The severity of these symptoms can vary among individuals, and the presence of such symptoms may suggest an underlying thyroid dysfunction that warrants further evaluation and treatment. After coming to a clinical diagnosis with history and examination, the doctors carry out investigations to confirm the diagnosis. In order to confirm hypothyroidism, doctors typically utilize a series of diagnostic tests. The serum TSH test is frequently employed to measure levels of thyroid-stimulating hormone, with elevated levels indicating primary hypothyroidism. Subclinical hypothyroidism may have normal TSH levels. If a pituitary disorder leading to secondary hypothyroidism is suspected, further investigations are carried out. The serum-free T4 test assesses levels of free thyroxine, and low levels may suggest primary hypothyroidism. Thyroid antibody tests, specifically checking for anti-TPO antibodies, are valuable in diagnosing autoimmune thyroiditis. Additionally, Ultrasound imaging may be utilized to evaluate the size and structure of the thyroid gland, particularly if a goiter is present. These tests are instrumental in enabling doctors to accurately diagnose hypothyroidism and determine the most effective treatment plan. The management of hypothyroidism aims to resolve symptoms, achieve normal TSH levels, and improve thyroid hormone levels in the serum while avoiding overtreatment that can lead to thyrotoxicosis, especially in the elderly. The standard treatment involves hormone replacement therapy with levothyroxine, LT4, a synthetic thyroid hormone. The recommended dose is 1.6 micrograms per kilogram, which helps normalize hormone levels and alleviate symptoms. LT4 has fewer side effects, is easily administered orally, has good intestinal absorption, is cost-effective, and has a longer half-life than natural T3. Monitoring of TSH levels is crucial during therapy, with levels checked every 6 to 8 weeks initially and then annually once TSH levels are within the lower half of the reference range. Overtreatment with LT4 should be avoided, as it can increase the risk of atrial fibrillation and osteoporosis. Regular compliance with medication is crucial to ensure optimal hormone levels and symptom control. Lifestyle changes such as maintaining a balanced diet and regular exercise can also help manage symptoms. Poor response to therapy may occur due to factors such as skipping doses, taking tablets on a full stomach, or increased hormone requirements from factors like malabsorption or drug interactions. In cases of increased requirement, dosage adjustments may be necessary to achieve optimal results. In cases where hypothyroidism becomes severe or decompensated, it can lead to a life-threatening condition called myxedema coma, which requires intensive care unit management. Myxedema coma is a rare, life-threatening condition that occurs when hypothyroidism reaches extreme levels, typically affecting elderly individuals. This medical emergency is often triggered by factors such as sedative drugs, antidepressants, pneumonia, congestive heart failure, or sepsis. Symptoms of myxedema coma include a decreased level of consciousness, seizures, and dangerously low body temperature. Additionally, patients may experience complications such as hyponatremia and hypoglycemia. Immediate intensive care treatment is essential, involving intravenous administration of levothyroxine, hydrocortisone, and broad-spectrum antibiotics. Correcting serum sodium and glucose levels is also crucial in managing this condition. In conclusion, hypothyroidism is a condition that can be effectively managed with the right diagnosis and treatment. It is essential to understand the causes of hypothyroidism, be able to recognize its symptoms, and adhere to the treatment plan prescribed by healthcare professionals in order to maintain overall health. Thank you for your attention, and we look forward to connecting with you again in the future. If you have found the information provided to be helpful, please consider liking, subscribing, and hitting the notification bell for access to more valuable content.